evening, ladies and gentlemen. Once again tonight, we are here for another show. But tonight, it's not about education. We're going to be talking about Dr. Gousse, where he came from, his career, his education. And to also help me do that, we have here with us tonight, Erica. Welcome, Erica.
Thank you.
Welcome, Dr. Gousse.
Welcome, Gina.
Dr. Gousse, how do you feel about having, for the last 15 years, nominated as best doctors?
Well, I feel honored, blessed. I want to thank God for this opportunity, thank my patients, and thank all those who trained me, and particularly thank my family who supported me, my wife and everybody else who supported me to be where I am. So I'm very grateful, very humbled by it.
Erica, you have any questions that you would like to address to Dr. Gousse?
Yes, Dr. Gousse, tell us, where did you come from in Haiti and the school that you had attended in high school, and a little bit about your background there?
Actually, I was born and raised in Haiti. I left Haiti when I was 17, 18 years old. I grew up in Port-au-Prince. I went to school in Port-au-Prince. Graduated from high school in Port-au-Prince, and after high school, went to New York City, where I started my pre-medical studies and majored in biology at the City University of New York at York College.
Okay. And you received a very prestigious award in medical school, I understand.
Yeah, well, the award maybe you're referring to, in medical school, I got some research awards, and actually, maybe you're referring to a scholarship that I had received, which helped pay for my medical studies. I don't know, you're referring to the Salk Scholarship? Yeah, the Salk Scholarship actually was given to me upon graduation from college. It was a competition, science competition, held with by a committee. Supported by Dr. Jonas Salk himself, who discovered pretty much the polio vaccine. In those days, in the remote past, many years ago, polio was a very deadly disease, and it did cripple many individuals by rendering them essentially paralyzed. So it was a scientific competition, and the top awardees got the award, and along with that came a scholarship which helped pay for medical school.
Wonderful. And then you went on to a residency program?
Yes. After I graduated from Yale University, which is where I went to medical school, while at Yale Medical School, I ended up working in a laboratory doing basic science research in muscle physiology and muscle pharmacology with Dr. Robert Weiss at Yale. And then he happens to be a urologist. In fact, he was the chairman of urology at Yale University School of Medicine at that time. So I had the privilege of working in his laboratory, and really that's perhaps how I decided to make my choice to become a urologist, because he had a very strong influence on me in my education when I was in medical school. So I ended up, upon graduation from medical school at Yale University, applying to become a urologist, applying for a residency program. And the residency program in urology actually is a 6-year program where I attended the Baylor College of Medicine in Houston, Texas, where the Bentop Hospital and the Methodist Hospital and the Texas Heart Institute, where I did a lot of my general surgery training.
Dr. Gousse, I realize that you've accomplished so many things. Would you give me a brief idea of what is your accomplishment that you're most proud of?
Well, besides my family and my friends and the community work that I do, my children, these are my greatest accomplishments at a personal level. I think that at an academic level, I think discoveries and contribution to the advancement of medical college, of medical education, have been things that I've cherished a lot, and things like the help to popularize the discovery of using Botox, for instance, to treat many urologic conditions, including urinary incontinence, has been something that I consider a great accomplishment because it's being used worldwide currently, and millions of patients are benefiting from this. So for instance, and other type of medications for bladder control, which I have helped investigate, and all these contributions in molecular biology, I think that it allows for the advancement of medical knowledge, and humanity hopefully will benefit and will continue to benefit from these research developments. So I think from an academic standpoint, if somebody can discover things that gonna have a widespread benefit in humankind, I think it's very worthwhile and something to feel very good about.
That was going to be my next question, because I saw that you're one of the chief surgeon investigator for medical device, Dr. Gousse. So I think you'd briefly talk about that, right?
No, I haven't yet talked about it, but actually there is a condition which is widespread, particularly in male, where they develop leakage of urine after prostate treatment, after prostate cancer treatment. They develop what is called incontinence of urine. And since 1971, actually, one of my former professors at Baylor had discovered this device then in 1970s. And since then, we haven't made any significant improvement in technology to treat this problem in terms of device development. So I work with this company called Precision Medical Devices, and we have developed Bluetooth technology-based fluid-free, meaning there's no fluid in the system, that's extremely simple but extremely precise and powerful, which is helping control outflow of urine and will help with urinary incontinence. I have to add, yes, I'm the chief surgeon, but we haven't implanted this device yet in human. We have a canine model, which means in animals and dogs, where we've implanted it, and it shows great promise and likely will be extremely useful to humankind and will revolutionize the management of a lot of incontinence and many other ailments, actually, which have nothing to do with incontinence, will benefit from the bioengineering and the technology that we are developing currently in the lab.
So this is good to know, Erica. Dr. Gousse, based on what you just said, I see that you're very involved. Your contribution to scientific side of treatment for penile issues or urologic disease is very huge.
Yeah, that's something that I've always liked, medical research. I've always liked investigation. I'm very pleased to see patients. As you know, I enjoy seeing patients, no doubt about it. But I've always found medical curiosity to advance medical knowledge. So even in college, I investigated why some bacteria become resistant to some antibiotics, particularly E. coli, which is a common pathogen, a common bacteria which causes urinary tract infection. I helped explain why they become resistant to certain type of antibiotics. In fact, that was this very project which won the Salk Scholarship because Dr. Jonas Salk, as a tremendous Nobel Prize level scientist, was very fascinated by this discovery and basically has led to numerous publications, which I was able to publish, co-author these articles in my early 20s, actually, when these articles came out. When I look at how far back these articles came, right now that I'm very old, I would say I can't believe it. But, and in medical school, I helped discover certain things we call receptors, which led years later to drugs which now are able to target to control the bladder. So a lot of the drugs that are currently being used to target the bladder, those what we call receptors, the pharmacology, are things that when I was at Yale in the pharmacology lab that I was investigating when I was a medical student. So it's good to see that it came to fruition. It has some applications. And when I was in my residency, I did a lot of research actually in prostate cancer and why certain prostate cancer metastasize and kill the host, kill the patient, and certain prostate cancers do that. So I was fascinated by this observation, so I worked on the genetic makeup of the cancer cells and did a lot of research to show that not all the cancer cells are the same, that although they are cancer, but they're more aggressive cancers than others, and these can be traced at a molecular level, at a genetic level, in the gene of the cancer cell. So I did a lot of this chromosomal research and sequencing of DNA of cancer cells when I was a resident.
Dr. Gousse, I was so fascinated when I read that you've been nominated Best Doctors for 15 consecutive years. But also, I saw that you were nominated for Top Doctors. First of all, what is the difference between Best Doctors and Top Doctors? And how did you get to have this for 15 years?
Well, first I must say that, I'm humbled by it. It's a great honor, of course. Basically, the Best Doctors Award is a very distinguished award, I would say, because you cannot ask to become best doctors in America. It's given to the top 4% within each specialty. So it's not only in urology, so you can get Best Doctors in America award in cardiology, in ophthalmology, in pediatrics, whichever field that they pool as best doctors. I happen to be in the field of urology, so obviously I got Best Doctors in America award in urology, and I received the award for the first time in 2005. So the last time I received it was this year, 2020, where, obviously it's been 15 consecutive years. And it's through a pooling of your peers as urologists. They select, they send out questionnaires. Who would you send your mother to, your father to, your significant other, who has influenced you, who has influenced the way you practice. Typically, although not always, individuals who have made significant contributions in the scientific field get this award, and individuals who have high volume or have great outcome of particular operations who are respected by their peers get this award. So you cannot ask for it, you cannot pay to have Best Doctors in America, so it has to, basically that award has to come to you. So this is basically what Best Doctors in America is. The fact you get Best Doctors in America, say in 2005 or 2006, doesn't necessarily mean you're going to get it 2007 and 8. Sometimes there's a skip of a year or two where you didn't make the 4% cut and the vote didn't go in your favor for you to have received that particular award. So it's considered, in essence, to be lucky to never have missed it and to receive it in every consecutive year. So that was extremely a luck, in a sense, and perhaps I deserve some of it. But this is basically what it is. Top Doctors is a significant award also. It's not given to anybody. It's a great prestige to get Top Doctors. Usually peers also nominate, and but there is some exchange of money to get the Top Doctors award, and then basically this is the criteria. So both of them, I would say, Top Doctors and Best Doctors are a great distinction, but in many ways the Best Doctors in America is a very unique award.
We're going to a quick break. We'll be right back.